This injection USP is a sterile solution of potassium chloride, calcium carbonate, and calcium chloride. Regarding parenteral formulation, which of the following is wrong? So, is this statement is wrong? Parenteral formulation must be pyrogen free. Here are some of the points regarding parenteral administration. Which one is correct? So, large volume parenteral formulation may be administered intravenously, and intravenous administration results in rapid onset of drug action. These statements are correct. Here are some of the points concerning water for injections and which of the following are correct. So, water for injection must be sterile, and water for injection has defined limits on the total amount of dissolved solids. These statements are correct. So, find out the correct statement, but both of the above statements are incorrect. That is, aqueous parenterals may be sterilized using dry heat sterilization, and oil based parenterals are commonly sterilized using moist heat sterilization. Maximum amount of medicament that can be comfortably injected via subcutaneous route is about 1.3 ml. Drugs injected into artery are called as intra-arterial injections. If sterilization of the ciprofloxacin infusion is achieved by autoclaving, which of the following statement is correct according to the IP? That is, it should be sterilized at 120 to 124 degrees Celsius for 15 minutes. With regard to this standard for sterile water for injection IP, the residue on evaporation limit is higher than water for injection IP. What should be the air velocity of laminar airflow? That is 100 plus minus 20 feet per minute. So, which of the statement is correct regarding phenol coefficient? That is, it measures the bactericidal activity and may be determined in presence or absence of organic matter, and it is expressed in numerical figure with respect to phenol as a standard. Choose the correct statement regarding propiolactone as a sterilizing agent. So, if we see the correct statement about propiolactone, that is, it is non-flammable at room temperature and act upon microorganism by alkalizing essential metabolism. Choose the correct statement regarding sterilization. So, bubble point test is done for testing of filters. Aseptic processing is technically not a sterilization process. The germicidal light produced by mercury vapor lamp is emitted at 253.7, and as per GMP requirement, the filters for sterile air are HETP filters. One of the most common buffers used in parenteral products is acetate buffer, whose pH range is 4 to 6. Type 1 and Type 3 glass are respectively borosilicate and soda lime glass. Choose the correct statement or combination regarding excipients, that is bulking agent and antimicrobial preservative used for commercial parenteral products, that is sorbitol as a bulking agent and benzyl alcohol as an antimicrobial preservative, which are used for commercial parenteral products. Neosome is a non-ionic surfactant based liposome. Choose the correct statement. So, RBCs have shrunken in response to hypertonic external solution. In lipid bilayer, hydrophobic fatty acid tails face each other within the bilayer and form a region that excludes water. An ideal controlled drug delivery system is it delivers a drug at a predetermined rate for a specific period of time. Liposomes are targeted drug delivery system. They act via uptake by reticuloendothelial system. Enteric coated tablet is an example of delayed release. Which of the following is not targeted drug delivery system? That is Buccal tablet. Which of the following drug would be most suitable for dermojet delivery system? That is insulin. Which is not related with the controlled release? That is increased fluctuation in steady state. Osmotic pump is based on osmotic pressure. Highly branched three-dimensional macromolecules with control structure with all bonds originating from a central core are known as dendrimers. The USB device to test disintegration uses six glass tubes that are 3-inch long held against the screen of 10 mesh size. The lab friability tester known as Roche friabilator, it resolves at 25 rpm and dropping the tablet at a distance of 6. Which of the following diluents is suitable for moisture sensitive drugs? That is lactose. Choose the correct statement from the following. That is, it is 7,000 to 13,000 times sweeter than sucrose. That is neotame. And neotame is rapidly metabolized and completely eliminated and doesn't accumulate in the body. NuTab is 95% sucrose and 4% invert sugar. ABCL is microcrystalline cellulose. The crown thickness of individual tablet may be measured by micrometer and tablet thickness should be controlled within the 5% limit. A new drug delivery system which is composed of phospholipids that spontaneously forms a multilamellar concentric bilayer vesicles with layers of aqueous media separating the liquid layer, that is liposomes. In transdermal drug delivery system, the potential gradient is used to increase the drug permeation across skin. The technique is known as iontophoresis. Determine the correctness or otherwise of the following. So, the true statement is glidance increases the flow property of granules. So, the correct statement about various excipients is disintegrant function by drawing water into tablet, swelling and causing the tablet burst apart. And diluents are fillers designed to make up the required bulk of tablet. Same determine the correct statement from the above. So both of these statements are correct, but R is not the correct reason for A. So the statement A is air permeability method is most common method for determination of granular surface area, and in air permeability the rate at which air permeates a bed of powder is used to calculate surface area. Here some of the trade name of some excipients and choose the wrong combination. So the first of all you see correct statements, that is microcrystalline cellulose is AVCell, modified starch is Explotab and hydrolyzed starch is Cellutab, but MDEX is not directly compressible starch. And most widely used diluents in the tablet formulation is lactose.